Thank you so much, Charlotte, for these wonderful words and beautiful introduction. It's a real pleasure and honor to be here with you in this closing and final session. Per, wonderful, wonderful documentation, beautiful lecture. And, you know, having a swimming cat that really must be with a UK name, I think it's just not possible the other way. But clearly, let me take you to our, let's say, strange event that happened in Geneva, or that occurred in Geneva. And you can see it here, the wonderful fountain, the jet d'eau, that is really our kind of an icon for the city. But more importantly for you is to meet actually our patient. You know, continuing a little bit with the theme of the entire event this year, you see here our patient Toby, that is actually 46-year-old, and he lives in Geneva. And then you will see, and you already have heard from Charlotte, how straightforward the case might have been. You know, a two-unit bridge, it can't deliver, and then you will see that some striking event actually happened. So let me introduce you to his case and to his issue, because what happened after only 1.5 months of clinical service is actually that this little bridge that looked so perfectly done by the technician in the first place, done by the latest technologies, combining the titanium base on the one hand side and introducing the latest technology with the materials on the high-strength ceramic on the other side, catastrophically failed in such a short time. And then the question is, why did this occur? And is that something that we just are not able to do as a cantilever bridge? Or is there something that went wrong with this kind of restoration in this poor patient in that sense? And have a closer look at the patient, and you will immediately understand some of the critical issues that we had to see, or that we had to evaluate once looking closer. And not only that you see that the tie base that was selected is very short, you can also see that the fracture line is actually not in the typical area where we would, in a way, foresee it, which is in the connector area.